Now we're going to share with you our solution, which was a caregiver community. So alongside with the LiveWorld team, we developed a private Facebook group called Navigating Dementia, a Mount Sinai community for caregivers. And so we've also teamed up internally with our Department of Geriatrics and Palliative Medicine. And the purpose of this group is to help caregivers, as Danny mentioned, the emotional and the financial burdens and challenges that caregivers face daily. And so this group is actually a little more unique because it's not only group engagement where other caregivers are connecting with one another, but these group members now have an advantage. They get to connect with Mount Sinai geriatricians in real time through Facebook. And it's often not a resource available to caregivers and patients where they get access to resources, any online resources, or getting to meet experts through private forums like a Facebook group.
So in the thinking area, we wanted them to think, wow, this is a great resource. I'm happy I found it. Second, we wanted them to think Mount Sinai has some incredible physicians and medical professionals that help us. And three, we wanted them to think, and this is something I ought to come back to day after day because it's very valuable and useful. On the feeling thing, we wanted them to think, oh my God, these are my people. Thank you. I'm now connected to people that are going through what I'm going through. They understand me. They know I'm not crazy. They know how to help me get through my day. And on the doing level, we wanted them to do two things. Number one, come back to the community. Number two, post in the community. And number three, consider Mount Sinai for their own medical needs and for the medical needs of their children. So the idea, not only in the do factor, was not only what to do, but we were trying to change the relationship of Mount Sinai to this potential patient population by saying, rather than an individual transactional kind of relationship, you need a scan, you need a procedure. We wanted to make people in relationship with Mount Sinai so that Mount Sinai became the go-to resource for all their healthcare and medical kind of needs. We focused really on the members. We tried to put ourselves in their shoes with a mantra of super serve the members. And one of the things that really surprised me, I grew up in direct marketing where you wanted to answer every question. I grew up working with call centers and online agents where you wanted one-click resolution. And one of the things I found out in watching the evolution of this community is that the acknowledgement was often as more powerful and it was a better answer than the specific answer. There were questions about, what do I do if my father won't put his pants on? And in some cases there was an answer, but in other cases there was we hear you, we understand you, I've had that experience, I'm praying for you, which were taken in as valid answers and were as satisfying as if somebody said, well, lay them down and stick on the pants. So it's a very interesting play of how these things happen. It's also remarkable to me that absolute strangers would open themselves up to open up and show their vulnerabilities, talk about very personal kinds of things in what is semi-public forum. So the benefits to the community are, the first is the biggest one, which is you're not alone. These are your peeps, and they know what you're going through. They don't question you. They won't criticize you. There's also, so it validates the feelings. There's also some palpable information that's shared. There was one of the earliest asked and answered questions was about shoes. And we had a gentleman who's actually a leading opera buff talk about his mother and recommend slip-on shoes so that dementia patients didn't have to tie their laces. So there's been a palpable exchange of information. There's this embracing of the condition and embracing of the situation. And there's a sense of safety that the members can count on, as well as every so often some very specific information. For example, there's been a lot of recommendations about music, using music to calm somebody down, or using music to reorient somebody, or using music to gently direct somebody to do something different than what they're doing. But also we have a marketing objective, and there's benefits to the hospital. The first of which is this change of relationship. But rather than the antiseptic doctor-patient relationship, we begin to develop an emotional relationship We've begun to build an ongoing relationship between the caregivers and the hospital, and we're beginning to see some interest in using hospital services by the people who are members of the community. So we hopefully have tried to combine super serving our audience with beginning to achieve some significant marketing objectives.
So you're probably all wondering what are our early results, right? We did all this whole roadmap. So what are we looking at? So in the first 100 days, we gained 600 members, and actually as of, I believe last night, we're close to 800 members. When we put this presentation together, we're a month behind. We have 75% of our members are female. 217 of these members have actively participated in a conversation within the group, whether it's engaging and with any of the 250 posts that were either research related, a video, infographic, and like Danny mentioned, the user generated content.
So
and that go ahead.
I was going to say, so you can see a third of the people were actively engaged. It kind of blew the 1-9-90 formula out of the box.
And we were just talking about it yesterday, that the group has started to basically run itself. You know, there's people asking us questions and we're providing the professional and the clinical information for them, but they're having these conversations. We're getting daily requests to join the group, and then the minute someone joins the group, they get a welcome message from Stacy, but then they instantaneously share their personal experience, share family photos, ask for advice, ask for help, and we're finally seeing it's not Mount Sinai's name all over the group. We're seeing Chloe, it's Danny talking, it's Reagan, it's John, it's Peter, it's all of these people talking now in this group and really engaging with one another. So of course the engagement with us is so important and so key, and it's there. But again, one of our main goals was to get these group members to talk with one another. Danny is going to guide us through next steps for our program.
So we're looking at next steps now, not only continue to fine tune this community, but look at other possibilities under that navigating umbrella moniker. We're also thinking about not only conditions, but geographies, given Mount Sinai's footprint in terms of locations and hospitals and urgent care centers. The other thing we've begun to do, and we've used a quiz to do this, is to begin to focus members of the community on themselves. You know, they're so giving, and in many cases, the caregivers are sandwiched between dealing with a parent and dealing with children. So we've put together a quiz focused on, with questions that ask caregivers to evaluate how they're doing. Have you had a wellness visit with your own doctor in the last 6 months? Have you been out of the house 3 times this week? Do you have an exercise regime? Do you have somebody nearby that could back you up if you've got to run out and do something else? So some simple kinds of questions in a scoring kind of way, which leads to some self-reflection. It's a fun thing. I don't know what your experience is, but in our marketing practice, we've been very successful at using quizzes for a variety of marketing objectives. There's something psychological or magical about a quiz, especially a short one, 5 or 8 questions, where people want to benchmark themselves, people want to participate. At one pharma convention, we actually had a leaderboard, and we had the endocrinologists fighting each other to get to the top of the leaderboard and answer the quiz. But the quiz also has been subtly pushing people toward service line marketing. So probably 5% of the people that have taken the quiz have already clicked on the appointment setter or the doctor finder on the Mount Sinai site. So we have some early evidence that this idea of changing the relationship structure is beginning to take hold and beginning to resonate with people in a non-sales kind of way.